Hi everyone, and welcome to this week's Wellness Wednesday episode of our Arthritis at Home program. My name is Maya Joshi, and I'm the program coordinator at Arthritis Consumer Experts. I'm so very happy to be speaking with Dr. Marie Westby today on the topic of physiotherapy support through telehealth. Dr. Westby has a Bachelor of Science in Physiotherapy and PhD in Rehabilitation Sciences from the University of British Columbia. She is the Physical Therapy Teaching Supervisor at the Pack Arthritis Program in Vancouver, and she is also a Clinician Scientist at the Centre for Hip Health and Mobility as a part of the Vancouver Coastal Health Research Institute. Currently, she is helping the Pack program set up their telehealth services to provide some support to patients while the clinics are closed to in-person visits during the COVID-19 pandemic. So thank you so much for joining us today, Marie.
Oh, thank you for having me.
Thank you. So to begin with, I think it would be super helpful if you could describe some of the terminology. We hear lots of words like telehealth, telemedicine, telerehab. Are these all the same things? And if so, what do they consist of?
Yeah, thanks. Some of the terminology is confusing. And so telehealth is kind of the blanket or the umbrella term, and telerehab would be a type of telehealth service. So telehealth, virtual care, telephysiotherapy, all are referring to the same thing. And basically it's the provision of remote care or education using some form of technology. And that can be everything from a telephone to a Zoom video like we're doing, wearable technology like Fitbits, apps, messaging, and all of those are forms of telehealth.
And then another thing I wanted to ask you about is some patients may have concerns about maybe the effectiveness of telehealth or how it differs from in-person visits. Can you speak to that?
Yeah, so there's been a lot of research in the last 10 to 15 years looking at telehealth. And the nice thing about it is that there's no geographical boundaries, and it increases access to care for people that live in more remote areas, people who can't travel in. And so they've done a lot of research to see, is the telehealth services for various health conditions equally effective as in-person or face-to-face visits? And in arthritis and chronic musculoskeletal conditions in general, after knee replacement in particular, there's been a lot of research in Australia, shows that telehealth services using a video interface like we're doing, and sometimes even more sophisticated technology, is equally effective as in-person visits. The combination of a couple of in-person visits followed by telehealth follow-up and care is that much more effective than in-person visits alone or telehealth alone. And patient satisfaction with the experience of having this interface, the option to join in when it's convenient for them, not having to travel, using technology effectively, is actually sometimes higher than in-person or face-to-face visits, which is really interesting.
Right, well, that makes a lot of sense, and that's some great news. And that sort of brings us to the next question of, are there any special considerations for telerehab compared to face-to-face rehab?
Yeah, so no different than face-to-face rehab. Physiotherapists need to follow their college regulations when providing care. So they still have to go through the same assessment of whether or not providing telerehab and information is safe and appropriate for the person to provide the service at home. They need to still go through a consent process. So patients, before they actually start a telerehab interaction or discussion, should be given some written information and provide either verbal or written consent to undertake the telerehab session. They have to consider things like privacy, confidentiality of information, who has access to the information. And a lot of that comes into what platform you're using. So we're using Zoom right now. There has been concerns lately with the use of Zoom, but there are some things that the physiotherapists can do on the back end to ensure better privacy, to make sure no one else joins the meeting, to ensure that people aren't sharing screens inappropriately. And then when Zoom, like we have at Vancouver Coastal Health, Zoom is behind like a firewall. So there's additional privacy options there. But the patient and the therapist need to consider whether it's FaceTime or Skype or Zoom or telephone call, what are the, the privacy and the confidentiality issues. So the therapists have access to some regulations and guidelines from all the colleges across Canada, have put out some nice guidelines for therapists to follow at this increasing time when we're using more and more telerehab.
Right. Well, it sounds like there's lots of good measures in place to ensure safety, security, and privacy in that process. So I was curious, does that mean, you mentioned that can be, Zoom, FaceTime, these different things. Does the patient choose which platform is used, or does each program have their own standard platform?
That's a good question. We're encouraging clinics to have some options. So most of the clinics will have a platform. They might use Zoom. They might use something called Jane, which is a booking app that they use to run their clinics, and that has a video interface on it. They might use technology such as PhysiTrack or Embodia, which are like an exercise prescription suite that they can also use. So clinics have often bought a license for one or two of those things, so that there's some options there. But patients may not be comfortable with use of that technology. And so they can also just offer a telephone call and just simply have a discussion over the telephone, and still send them either by an email attachment some copies of exercises or guidelines. So there should be an arrangement. Are you comfortable using, say, Zoom, or do you have the equipment that you need at home? Do you have a fast enough computer? Does it have audio? Does it have video? And if it just works out that the patient isn't comfortable in setting that up, then a telephone can work really well too.
How can patients, people like myself, go about finding a physiotherapist for telehealth?
Yeah, great question, because more and more physiotherapists are advertising now, or offering telehealth services. And I've been looking through the various professional organizations across Canada in the last week, and pretty well every province is updating their Find a Physio or Find a Physiotherapist search engine within their websites, and having therapists who are providing telerehab add additional information to their profiles, so that you can, for example, on the BC one, and I know that link will be provided at the end, you can scroll down and select, I'm just trying to make sure I have this right. You can scroll down and click area of practice and select arthritis, so that you're looking for a provider who says they provide care to people with arthritis. And then you can go down further to advanced search. And most of the provinces, I've noticed, the telehealth option is under advanced search. And then you can click on telehealth or virtual care. And that way you're partnering a therapist who has arthritis knowledge or experience and is providing telerehab. And that's probably the best way to search for a provider. Having said that, though, if you already have a therapist that you have an established relationship with, and they've already worked with you before, they know your concerns, they've done assessments and that, the first thing to do would be to contact them, either directly or look on their website and see if they are offering telerehab, because that's probably a better place to start than starting with a brand new therapist at this time.
And for a person that's about to start telerehab for the first time, what sorts of questions should they ask their therapist before starting?
Yeah, and I wrote down some to make sure that I don't forget. So one of the things would be that the equipment. What do I need if I'm going to have this telerehab appointment? Do I need a laptop? Can I use my phone? Can I use a desktop computer? Do I have to download any special software or apps? There's lots of hesitation sometimes around adding new apps or software to your computer. So that's an important question. Some therapists are offering free short initial consults, like a 15-minute consult, to see if this telerehab experience is going to work for my condition at this time. So definitely ask if they provide that initial sort of free quick consult, and then how much do they charge for any ongoing consultation. Definitely ask questions about the privacy and confidentiality of the information. Where is the information stored? Is any of it being recorded? Who has access to it? And I would ask, because especially for people with an inflammatory arthritis or more complex forms of arthritis, I would definitely ask the therapist, do you have experience providing care for people with, for example, rheumatoid arthritis in person as well as through telerehab? And it's the combined experience that you're really looking for.
So what sorts of equipment should people that are thinking about or going to do telehealth rehab have? Like, do they need equipment that you'd find in a gym usually or at your physiotherapist's clinic?
Yeah, so if it's going to be something where you want the therapist to look at your knee, for example, it's swollen and it's bothering you, you're going to have a phone or a laptop or a tablet, and possibly a family member or a friend who can hold it for you and move it so it's looking at your knee. So you're going to have the physical space to show the joint or your body position. You may do this someplace where you can, either if it's comfortable, lie down on the floor or lie down on a bed or a couch if you need to demonstrate something or practice an exercise. So definitely the space or a mat to do that. They may ask you if you've been given like TheraBand or any exercise equipment in the past to have those all ready to use when they demonstrate exercises to you. But the idea is that they provide you with suggestions that you can do at home. You're not going to go out at this time and buy any props or equipment or dumbbells or anything like that. So it's a time for therapists and yourself to be creative in terms of what you can use at home in terms of what's around the house. There's lots of different exercises, especially for strengthening, where you can just use your own body weight, and they may show you how to use a chair, or a couch, a wall, things like that. But that's a really good question to have right at the beginning. Before my first telerehab visit with you, what do I need to have in place in terms of equipment?
Right. And I mean, I think that sounds great, actually, having these exercises and therapy be specifically what a patient has at home, because those things could be really convenient even after this whole COVID-19 situation is over. So.
Yeah, absolutely. And it's a unique situation for us as therapists. We don't usually get insight into a patient's home. They come to an artificial environment, to a clinic or a gym where we have all this nice equipment and specialized bikes and weights and everything. And then we ask patients to go home and try to mimic or try to set up the same experience at home. And sometimes that's quite a leap. So when we can see actually what they have in terms of types of chairs they have at home and heights, and do you have a step that you could do that on, and what could you attach the TheraBand to, it helps us to problem solve. And I think it's a really nice opportunity for us to say, oh, okay, those are some of the limitations of my having given that exercise. That's actually going to be maybe a bit challenging for them to do at home. How could I modify it?
One last question I have is this telehealth rehab, will everything remain the same in terms of like reimbursement that you would get through private insurers? If you have the information to answer that question.
I do. It's changing weekly. So again, the professional organizations in BC and across Canada will have information on their websites. So they're working with third-party payers like insurance corporations or workers' compensation, extended health, and payers. Some of them have come on board right away, and they are reimbursing patients who have extended coverage for their telehealth services. Some will only reimburse for ongoing treatment, so that if a patient had already had a relationship going with receiving therapy with a therapist, they could continue through telerehab, but they couldn't initiate a new treatment session. So the Canadian Physiotherapy Association and our various provincial bodies are trying to work with those third-party payers to try to get access or full reimbursement for telerehab services. And I hope going forward that will continue, because I think people will see this is actually a really nice option.
Yeah, definitely. And I think you hit the nail on the head there, that that this is creating more like possibility for this to always be in place for patients, maybe more frequently and more conveniently than it was before. So, so that's great moving forward, and for a patient like myself, knowing this will continue to be an opportunity, hopefully.
Yeah, absolutely.
So I wish we could keep chatting. You have so much wisdom to share. We are going to be posting everything that Maria has shared with us in terms of the links and resources. We're going to be posting them along with the interview. So our viewers at home will be able to have access to them. And we just want to thank you so much for speaking to us about this very important topic for people living with arthritis. And we want to thank our viewers at home for tuning in and watching. We just want to welcome everybody to leave comments or feedback that they have below the video, and also to tune back in on Friday for our Facts Friday episode of Arthritis at Home.